I'm Dr. Amani Jambakar. I'm a fellowship-trained breast surgical oncologist, and recently one of my patients asked me, how does getting COVID impact my risk of my breast cancer coming back? This is a study which was recently published in Nature looking at whether or not respiratory viral infections like COVID and the flu awaken metastatic breast cancer cells in lungs. And they used mice to actually look at the mechanisms through which this was happening and found out that yes, metastatic breast cancer cells, which were dormant, were activated by getting an infection like COVID or the flu. The other way they looked at this was doing a population study using the UK Biobank and enrolling about 4,800 patients. They compared the patients who had a cancer diagnosis with the patients who had both cancer and COVID to see if the mortality rates were the same between the two of them. When they excluded the patients who died directly as a result of their COVID infections, they found that patients who both had cancer and COVID had an almost double the mortality rate compared to the patients who just had a cancer diagnosis alone, further supporting the theory that getting COVID actually does cause metastatic cells to wake up and start growing in other places. They also used the Flatiron Health database with 37,000 female patients with breast cancer to specifically look at whether or not patients with breast cancer experienced an increased risk of progression to metastatic disease in the lungs. And they found out that patients who had COVID and breast cancer had a 40% greater chance of developing metastatic disease in the lungs. So the takeaway from all of this is that people who have had COVID and breast cancer are more likely to see their breast cancer come back. So if you are someone who's been treated for breast cancer in the past, it's important to stay up to date with the vaccines if they're available in your country. Unfortunately, in the US, that is not the direction in which we're heading. If the vaccines aren't available, to wear a mask and to avoid getting COVID as much as you possibly can.